Bismillahirrahmanirrahim. Let's discuss about A scan and B scan. Ultrasonography principle. High frequency sound waves are focused on the tissue of interest and echoes of reflected waves are measured. Higher frequency waves penetrate less but have better resolution. Low frequency waves better penetration but less resolution. Velocity of sound increases in solids as molecules are very close to each other as compared to the liquids. So important point is frequency is inversely proportional to penetration. Increased frequency, less penetration. Increased frequency, better resolution. So frequency is directly in relation to resolution and inversely to penetration. Sound waves returning to transducer are called echoes. Imaging zones can be hyperechoic echoes. We will talk in echo. Hyperechoic, hypoechoic or anechoic. Shadowing distal to a very dense lesion can result in anechoic area. A scan has frequency used 8 megahertz and B scan uses the frequency of 10 megahertz. So our focus today is on ultrasonography, mainly on B scan, but A scan, plot of amplitude versus time delay, is known as A scan. Amplitude scan, it is also called as amplitude scan, and it describes the tissue structures at a given point in the form of spikes corresponding to tissue interface. Tissue interface के accordingly it gives the amplitude spikes. So one-dimensional scan. And single round beam is propagated. Tear film act as a coupling agent. The echoes that are returned to the transducer are converted into a series of spikes. Echoes are converted into series of spikes with height proportional to the strength of the echo. Height is directly proportional to the strength of echo. So B scan echoes in the B scan are converted into dots with brightness intensity that is proportional to the echo amplitude. Higher the echo amplitude, higher is the dot with bright intensity. So amplitude echo, increased amplitude white color will be shown, absent echo black color will be shown. If we increase the gain, it will allow for the capture of weaker echoes. If we increase the gain, we can capture the areas of weaker echoes, and it is a two-dimensional image. And so diagnostic ultrasonography basic principle. Ultrasound describes sound waves with frequency above the upper limit audible to humans, which is more than 20 kilohertz, 20,000 hertz. In medical ultrasonography, these high frequency sound waves, ocular are 8 to 10 megahertz, orbital are 4 to 5 megahertz, and tear segment are 50 to 100 megahertz. Are focused on the tissue of interest. In the echoes, the reflected sound waves are measured. Ultrasonic probes contain a piezoelectric crystal for both sound wave generation and echo measurement. Piezoelectric crystal. And this piezoelectric crystal. So this piezoelectric crystal is one that expands or contracts at high frequency when an electric voltage is applied across it, and that produces an electric current when sound waves are applied across it. Once captured reflected signal is amplified, the gain control can be used to adjust this amplification. The resulting plot of amplitude versus time delay is known as A scan and describe the tissue structure at a specific point. By multiplying the time delay from any reflected interface by the speed of the sound in the tissue, a scan can be used to obtain accurate measurements of ocular structure. The scan can be repeated at multiple transverse locations, mapped to a grayscale producing two-dimensional cross-sectional image through term B-scan. So ocular ultrasound के basic principles हैं बी स्कैन की indications and identification of posterior segment pathology in presence of media opacity, characterization of intraocular masses, location of intraocular foreign bodies, detection of calcification in retinoblastomas and optic disc protrusions. Method is to give the topical anesthetic drop. Coupling agent is applied to the tip of the probe like methylcellulose or the to the closed eyelids. Patient is reclined and placed in a supine position. A marker of the ultrasound probe is used for orientation. When the marker is lined horizontally with the lid, the image displayed in a horizontal plane. Vertical placement generates an image in the vertical plane. Scans are captured with the patient's eye in primary position and then sequentially in all four quadrants, horizontally, vertically. If the probe is moved temporally from the primary position, the scan shows the nasal retina. If the patient moves their left eye nasally while the probe is moved temporally, the nasal retina anterior to the equator can be scanned. Scanning during the eye movements can help differentiate between PVDs and retinal detachments. This is dynamic scanning. Very important point. If the probe is moved temporally from the primary position, the scan shows the nasal retina. If the patient moves their left eye nasally while the probe is moved temporally, nasal retina anterior to the equator can be scanned. So this is about the ocular ultrasound. So here are some examples. A posterior hyaloid phase is only faintly reflective and appears incomplete on a static image. Posterior hyaloid phase. Ultrasound of PVD. Ultrasound of retinal detachment, and this is the A scan and B scan, both pictures are shown. Here is the detached retina and here is this is the A scan. So here is a picture of ultrasound of buried drusen. Ultrasound of buried drusen. Then here is a picture of ultrasound of posterior scleritis. Well defined thickened sclera and fluid in the tenon space. Well defined thickened sclera and fluid in the tenon space. So here is the ultrasound of choroidal detachment. The retina and choroid appears as highly reflective regular dome-shaped membrane. Dome-shaped membrane. Dome-shaped membrane. Then we have the mass, dome-shaped membrane with low internal reflectivity on a standard A scan. Ultrasound of choroidal melanoma. Then we have the corneal. This is the A scan. Some other B scans are round encapsulated lesion in front of the retina. Diagnose dislocated lens. This is the linear hyperechoic shadows. Dropped IOL. Hyperechoic linear shadow intraocular foreign body. Low intensity cause scattered ill-defined vitreous hemorrhage. Hyperechoic vitreous opacities, asteroid hyalosis. Flap subretinal fluid beneath the flap retinal tear. Dome-shaped rigid and thin retinoschisis. Dome-shaped contour multiple donut lies Multiple domes lies in the middle of the vitreous. Choroidal detachment. Irregular lumpy contour, medium to high internal reflectivity. Metastatic tumor. Optic nerve phleuma, fusiform with low to medium plus regular internal reflectivity. Optic nerve in high regular internal reflectivity. Potential areas of calcification: irregular dome-shaped mass lesion within the vitreous cavity, calcification, retinoblastomas. That's all.